Hi everyone, hope you're doing well and happy Women Wednesday. Today we're going to be talking about PCOS Awareness Month, which is the month of September, also known as Polycystic Ovary Syndrome. We're just going to get Whitman-Walker in the room and then we'll get started on today's topic. Such a dreary day all up and down the East Coast. Hope everyone's keeping dry. Just get this comment pinned. If you are looking to access HIV or STI testing in the DMV, Whitman-Walker's got testing appointments available, so you can schedule an HIV or STI testing appointment by calling 202-797-4439. While we wait for Whitman-Walker to join the space, I will introduce the space. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. Today we're going to discuss the federally designated holiday that is PCOS Awareness Month. So September is all about polycystic ovary syndrome awareness, and it's a hormonal disorder common among women and people who are assigned female at birth who are of reproductive age. With PCOS, many people have infrequent or prolonged menstrual cycles and or excess male hormone in androgen levels. September 1st actually marked World PCOS Day of Unity, and it's a day dedicated to bringing, breaking the silence about PCOS, raising awareness about this health experience, and working toward more health solutions and options for people with PCOS. According to PCOSawarenessmonth.org, polycystic ovary syndrome is a genetic hormone, metabolic, and reproductive disorder that affects up to 15% of women in the US and over 20% in some parts of the world. It is one of the most common human disorders and the most common endocrine or hormone disorder and cause of infertility in women. It can lead to lifelong complications, psychosocial disorders, type 2 diabetes, cardiovascular disease, and endometrial cancer and other serious and life-threatening conditions. And about 50% of women or people who are assigned female at birth are going undiagnosed with PCOS. So if you're experiencing any of the following symptoms, please consider getting screened by a medical professional for PCOS. These symptoms include irregular periods, excess facial and body hair, severe acne, small cysts in the ovaries, insulin resistance, anxiety and depression, infertility, weight gain, or male pattern hair loss. Also, according to PCOSawarenessmonth.org, 50% of people who are assigned female at birth or women develop type 2 diabetes before age 40. These individuals are also at 3 times the increased risk of developing endometrial cancer. Mayo Clinic shares the following definition for endometrial cancer. It's a type of cancer that begins in the uterus, and endometrial cancer begins in the layer of cells that form the lining or the endometrium of the uterus. Endometrial cancer is sometimes also called uterine cancer. This same resource shares that the estimated cost to diagnose and treat PCOS would be about $4.3 billion to the US healthcare system. It seems like a bit of a worthy expenditure, but there hasn't been much funding or research given to this health issue. Irregular menstrual cycles and hyperandrogenism, or the excessive presence of male sex hormones, testosterone, androsterone, and androstenedione in women and people who are assigned female at birth are present, then these can be grounds for being diagnosed with PCOS. So again, if you've got irregular menstrual cycles and you're experiencing hyperandrogenism, then the PCOS organizations kind of recommend that that's enough to diagnose them with PCOS. You don't have to do an ultrasound to do it. That should be indicators to look for. And so once you're diagnosed, your provider can offer oral contraceptives to help balance some of the hormones and symptoms if that's what you decide to do. You may also be prescribed metformin, which is often used to treat high blood pressure levels that are caused by diabetes. And then to battle any infertility issues you might experience as a result of having PCOS, you could be prescribed letrozole, which is an oral drug usually used for treating breast cancer, but it can be effective for fertility treatment for women and people who are assigned female at birth, who are having problems with ovulation, or for those who just have unexplained infertility. You could also be prescribed this is a really hard word, y'all. Gonadotropins. I'm going to spell it Gonadotropins, which are hormones that are synthesized and released that act on the gonads or testes and ovaries to increase the production of sex hormones and stimulate production of either sperm or ova. So your provider may also screen you and offer support for depression and or anxiety. Again, these are all kind of symptoms and some of the side effects that come with PCOS. Thanks for learning a bit more about PCOS. I know that I personally did not know all of these facts about it. But before we go, I just wanted to share a few reminders about HIV and STI prevention and testing services available through Whitman-Walker. You can learn about Whitman-Walker's testing hours and locations at whitman-walker.org/testing. HIV and STI testing are available by appointment at Whitman-Walker's locations. You can call 202-797-4439 to schedule a testing appointment at either their Northwest or Southeast locations. If you or your community or organization is interested in having Whitman-Walker provide mobile health services in your neighborhood, you can contact mobilehealth@whitman-walker.org and get access to HIV prevention tools like PrEP or PEP or start HIV treatment with Whitman-Walker at either our Max Robinson Center in Anacostia or Health Center on 14th Street at 1525 14th Street. Finally, please save the date for Whitman-Walker's 36th annual Walk to End HIV on Saturday, October 22nd. You can register to walk or donate at walktoendhiv.org. And this year's walk will take place at Whitman-Walker's new medical home on the campus of St. Elizabeth's in Congress Heights. That's right off the Green Line. Again, thanks for taking time to learn a little bit more about PCOS, where to get tested, how to prevent HIV, and how to help support the fight against HIV. Again, also before we go, we want to give you some reminders about COVID-19 and monkeypox. So if you've already gotten your COVID-19 vaccine, that's awesome. You've taken a really big and important step towards helping your loved ones and your communities from getting sick. Multiple variants can continue to sort across the world, so it's understandable if you want to keep wearing your mask in closed spaces where there's really poor ventilation and it's tightly packed. As we know that the vaccine does not prevent you from getting COVID, but it does help keep your COVID a really mild and light experience, so you won't end up, getting super sick with COVID, won't end up in the hospital with COVID, and likely won't die related to COVID. But keep alert. If you haven't been vaccinated yet and you're looking for an appointment, Whitman-Walker Health has vaccine available. Please call us at 202-207-2480 to make an appointment. And if you're having trouble reaching our locations for vaccines or just out of reach for you and you're a DC resident, you can find more information about COVID-19 vaccines at vaccinate.dc.gov or by calling 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. If you have not been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines on mask wearing, social distancing, and the like, and quarantining. It's super important that you consider getting vaccinated, but at least discuss COVID precautionary measures with those who are around you and just be mindful of masks and keeping your distance, but especially when you do not know whether a person has been vaccinated or not. On to monkeypox. So, according to the CDC, there are more than 20,000 cases of monkeypox documented in just the U.S. In DC, you can register for, or you can pre-register for monkeypox vaccine appointment at the DC Health website. Maryland and Virginia also are working for pre-registration and contact tracing in terms of matching of their vaccine supply. So visit your local state department's health website to get the latest information on what their process is for dispersing monkeypox vaccines and contact tracing. As of early August in DC, there are some walk-up locations for monkeypox vaccination located at 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, 7530 Georgia Avenue Northwest in Ward 4, and 1900 I Street Northwest in Ward 2. Walk-up vaccines are available on a first-come, first-served basis to eligible residents who have not already received a first dose, and they actually have started, I believe, to schedule second doses as well. So heads up on that. but check the DC Health website for the latest criteria on who is able to get a monkeypox vaccine, and just stay alert. Monkeypox is mostly spread through skin-to-skin contact. It can also spread through respiratory droplets, but the most common way is, again, kind of skin-to-skin contact with an open blister or open monkeypox wound. So be alert out there, be careful, and stay safe. And thank you all so much for learning a little bit more about PCOS. And